Okay, let's go ahead and see if I can find my notes and jump on into the topic of the day. So, for those of you that are new and may not know who I am, my name is Nicole Broadhurst. I'm a former healthcare administrator turned independent patient advocate, founder of The Circle, and CEO of Tennessee Health Advocates, where I help busy, committed professionals maintain work life balance without the frustration of medical billing departments. That's what I do over there. But on Wednesdays, I help you guys build, create, and sustainable practices for your advocacy practices. So, why did I start the circle? So I opened my business in 2019, and then by 2020, I was ready to quit. Like I was tired of being on the hamster wheel. I was spinning my wheels. I was chasing shiny objects, and nothing was really working. I wasn't making any money. I was ready to go get another job. However, in late 2020, I met Jason Elkins and I attended his 100 Cup Academy. And what I learned in there was amazing. I learned that I needed a community in order to grow my business, increase awareness of our profession, and maintain alignment with who I am and why I became an advocate in the first place. So if any of that resonates with you, you are in the right place. So grab your pen and paper, get something to drink, drop questions in the chat. I promise we're going to get to them at the end. There's a lot of information here, so don't be overwhelmed. That's why we record it and get it posted into the community. So instead of 3 topics today, I really just want to talk about 2. And the reason is because there's lots of information under each one of these. We're going to start by talking about the title of today is Must Knows in Medicare, right? And so this is a series that I really wanted to put together based on Medicare benefits and coverage that I believe every advocate needs to know. You may not need to know every little detail of these things. However, I want you to be aware of them, right? And know where to go to get the support. So the first thing is skilled nursing facility. I want to talk about the benefits and just a general overview, okay? So the way that it works is this, and you may know some of this. The Medicare Part A is what covers skilled nursing facilities, okay? The benefit period for skilled nursing facilities under Medicare Part A is a maximum of 100 days. All right, so 100 days is the maximum benefit for skilled nursing facilities under Medicare. Now, this is renewable, okay? So the way that it reads is this. You get a maximum of 100 days per benefit period. What's a benefit period? Right? So you will start a new benefit period when, okay, let me start this way. The benefit period starts the day you're admitted as an inpatient in a hospital or a skilled facility, but we're gonna stick with hospital, keep it simple, okay? So your benefit period under Medicare to trigger this starts the day that you're admitted inpatient to a hospital, all right? The benefit period ends when you've not received any inpatient care or skilled services for 60 consecutive days. All right. So if somebody goes into the hospital, their benefit period starts. If they're in the hospital for 2 weeks and then they go home, they have to be home receiving no skilled services for 60 days. And then if they go back to the hospital on day 61 or 62, they start a new benefit period. Okay? So you can have multiple benefit periods in 1 year. Right? Which means that it is possible to utilize and trigger these 100-day benefits in a skilled facility more than 1 time a year. All right? All right. So what triggers the benefits? Currently, it's a 3-day hospital stay, and there's a 3 midnight rule, okay, to start that benefit. Okay? Now, there are exceptions to this. This is one of those things I want to say it's a caveat, but it doesn't happen very often. But here's what you need to know about this. Your client may not require a 3-day minimum hospital stay if the doctor participates in an accountable care organization, an ACO, okay, or any of the other Medicare initiatives that are approved for waiving the 3-day stay. Okay, how will you know if the provider participates in an ACO? You want to check with them, and you also want to check on your Medicare Advantage plans, because some of them also waive the 3-day hospital stay. Okay. So there are exceptions to the 3-day hospital stay. And I also know that there's some lobbyist and legislation and some discussion around eliminating the 3-day hospital stay, but it's not happened yet. Okay. So the other thing, okay, so the benefit period starts when you are admitted to the hospital or when a patient is admitted to the hospital. In order to access the benefit, they have to have a 3-day hospital stay or be there for 3 midnights, the 3-midnight rule, right? There is exceptions, so you'll want to check on those exceptions like Medicare Advantage or whatnot. And here's a little known fact that I want you to know about this too. There's also a benefit window, okay? So, for example, if somebody goes into the hospital and they start their benefit, they're there for 3 consecutive midnights, they've met their 3-day stay, and then they discharge home, there is a 30-day window that they can still choose to access this benefit without having to go back to the hospital. Okay? So if they decide to go home following, let's say mom has a stroke, she ends up in the hospital, she thinks she's all good, everybody thinks she's good, we discharge her on day 4, we take her home, and within the next 30 days, we're like, oh no, that was probably not what we needed to do. Let's consider getting her admitted to a skilled nursing facility in this 30-day window. That is still a possibility. And I'm going to tell you, as an admission director at a skilled nursing facility, I exercised that a lot. Because there were a lot of times that people thought they could go home. And so before they went home, I would work with them to get the information on file directly from the hospital. So this is what I would say. If you have a client that's in this situation, I'm going to suggest that you work with the discharge planner / social worker to get the information to the facilities that you want to consider. And then even if they don't go and they go home, at least you know that information is already on file, because there are things that they need, right? They'll need the x-ray, chest x-ray. There's things that they need that will need to generally come from the hospital. Make it easier. Make it easier. You can do it without it. I have done that too. I've received calls where people were within the window and they were home and they wanted to come in, and I was able to work with their PCP to get the appropriate documentation. It's just a lot easier if I already had it on file from the hospital stay. Okay. So, all right. So the benefit period starts when we admit to the hospital. We need a 3-day hospital stay, 3 midnights. There's exceptions, Medicare Advantage plans, maybe ACO participation. Then you have the 30-day window after discharge where you can still access that benefit. All right, so what does it cover? So generally it covers a semi-private room, meals, skilled nursing care, any of the therapies, physical, occupational, speech, social services, medications, supplies, any equipment that's needed, transportation, ambulance transportation, and dietary counseling. Generally speaking, those are the things that it covers. Okay. Now, there is a copay for these 100 days. All right. So days 1 through 20, the copay is 0. Okay. Medicare pays 100% for 20 days. Days 21 through 100, it's $200 a day. All right. Now, it's possible there's supplemental policies that work in conjunction with Medicare Part A that will cover that. So that is an option. And then, of course, any days over 100, there is no Medicare coverage. Okay, the benefit exhausts at that point in time. And the patient becomes 100% responsible unless they have some other coverage. They have a long-term care policy, they have Medicaid or something like that. Maybe they were dual eligible. Okay. All right. So the second thing I want to talk about, because this really leads into because there's always questions around how many days do you get of those 100 days? Because they say there's 100 days, but then randomly in the middle of those 100 days, we get a phone call that says, your mom no longer meets criteria, and so she's going to be coming off of Medicare tomorrow. They can't do tomorrow, but they can do call you on Tuesday and say it's going to happen on Friday. That can happen. All right. So the thing about this is the patient has to continue to meet what they consider skilled criteria and receive skilled services. All right. Now we're going to get into some of this stuff that gets really complex. So I'm going to share the basics, and then we'll open it up for questions and do some case questions and scenarios and that kind of thing. So general information is this. Skilled services at the very basics are something that requires a professional nurse to administer or perform, right? Any of the therapies, okay, speech, occupational, physical therapy, lots of times respiratory therapy will qualify for skilled services. All of those things, generally the big bucket, skilled nursing and or therapies. Just kind of keep a high level, right? Okay. So this is where we run into, and I want everybody to be familiar with the Jimmo ruling. Is anybody not familiar? Oh, good. Okay, so everybody's got a little bit of information on this. Awesome. So back in 2011, there was a class action lawsuit that was brought forth by the Center for Medicare Advocacy, and I think they used Vermont Legal Aid. Anyway, they addressed the Medicare coverage denial for skilled care due to lack of improvement. Now, if you've been around for a while, and most of us have, you've heard this phone call that says, hey, I'm calling to let you know that mom doesn't need skilled services anymore, and effective on Friday, she's going to have to come off of Medicare's not going to pay for her stay anymore. And very, 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 very common is to hear, well, she's not making any progress. She's hit a plateau, right? That is not the intention of the Medicare benefits. Medicare has the ruling in 2013, and to this day is that the benefit is there to prevent decline or to maintain a level of function. So not making progress and not getting better is not an appropriate reason to take somebody off of Medicare coverage. That's the crux of the Jimmo ruling. Okay. Now, there's been a lot, back when it happened in 2013, there was supposed to be a lot of education around this for providers. There was a lot of action items that CMS was supposed to take as a result of this ruling, which they did. They did meet the guidelines and the criteria for the ruling. However, recently, in late 2023, there was a big 10-year review of the case ruling and an assessment done to see, where were we at in relationship to where we were then. And nobody's going to be surprised to hear that even today, many, many providers are not familiar with what we're talking about. They just aren't aware. And it is not uncommon for us, even today, I get phone calls and I hear about cases where patients are being told that mom's not progressing and she's hit a plateau and Medicare's not going to pay anymore. These are situations as advocates, I'm going to encourage you to appeal. Right? because there is lots and lots and lots of documentation. Actually, you can go directly to CMS. There's so much information that I can't go over all of it today, but I'm going to drop a link and I will make sure that it gets posted with the video. But there's all kinds of tools and forms and rulings and educational pieces. And this is just an area that I'm going to encourage every advocate that if you hear that, take on the role of educator. Because if you hear that statement, you are dealing with someone who does not understand the intent of the Medicare benefit. Okay, so I'm going to encourage you that when that happens, kick yourself into educator mode and gather up all of the information and present that to assist the provider. Because here's what I really want to say about this is providers don't like cutting people off from Medicare. That's not the goal, right? They're doing it because they think that that is the right thing for them to do. They think that that is the intention of the benefit, and that they think that if they continue to service the patient and continue to keep them covered under Medicare, that they're actually going against the standard, right? And so it becomes a real opportunity to educate them on that. All right. So that's the Jimmo. There is a page actually that was created and has all of the 10-year, I'll copy this one too. All of the 10-year review information as well. So there's a space there. And then of course, there's one other link that I did want to share. This is in regards to just general skilled nursing facility benefits. And you can get more information there. All right, perfect. Let me take my notes. I think those are really the biggest things that I wanted to make sure that you were aware of. Medicare must-knows in Medicare.